After having studied this module, the learner will be able to discuss the difference between disease outbreak, epidemic, and pandemic. Identify correct behavioral practices to be followed to prevent self-infection and spread of the disease. Explain social distancing, self-quarantine and self-isolation. Identify potential fomites and personal protective equipment to be used at workplace. Let us start with Unit 1. General practices for an outbreak or pandemic. In this unit, we will learn to differentiate between disease outbreak, epidemic and pandemic. Explain the rules and guidelines for epidemic or pandemic. Distinguish between self-quarantine and self-isolation. Discuss norms for maintaining social distance during a pandemic. What is a disease outbreak? Disease outbreak specifically refers to a sudden occurrence and exponential rise of a disease. Disease outbreak is often caused by an infection which is transmitted to a person from another person, animal, environment, or any other source. However, there are times when the cause of outbreak remains unknown. May last a few days, weeks, months, or even years. DDT or mercury-related diseases are examples of chemical-related outbreaks. For example, Zika outbreak in 2015. Aedes mosquito spread the Zika virus in Brazil, America and Southeast Asia. It caused brain anomalies in the newborns when pregnant women were infected. Most of these infections were asymptomatic. What is an epidemic? Epidemic refers to an infectious disease that spreads actively and substantially across a specific location affecting large number of people within a short span. For example, no one had heard of severe acute respiratory syndrome, or SARS, before 2003, but it affected over 8,000 people and killed 1 out of 10 of them. Similarly, epidemic of Middle East respiratory syndrome, or MERS, across Middle East in 2012 to 2013, and the Ebola epidemic in West Africa in 2014 caused fear and panic as well as inflicted massive damage to the economy. Ebola epidemic spread from infected bats and fluids of infected humans and was in the sub-Saharan Africa mainly. What is a pandemic? When an epidemic spreads across various countries, it becomes pandemic. It affects larger number of people across the globe, causing greater number of deaths as compared to an epidemic. In addition to adversely affecting people, it has a drastic impact on the economy at large. Measures to control pandemic undertaken are stringent, like partial or complete lockdown. For example, 1918 Spanish flu, 2009 swine flu and 2020 COVID-19. Let us learn about some key highlights of a pandemic. It affects a wider geographical area, often worldwide. It infects a greater number of people than an epidemic does. It is often caused by a new virus or a strain of virus that has not circulated among people for a long time. Humans usually have little or no immunity against it. It causes higher numbers of deaths than epidemics. It creates social disruption, economic loss and general hardship. Now, let us learn about some rules and guidelines during epidemic or pandemic. The spread of viruses or pathogens in humans happens due to pathogens which are airborne, droplets, direct human contact, indirect contact, such as insect, animal, or surface, contaminated food or water, blood-borne. There are 4 main guidelines to be followed during an epidemic or a pandemic. Personal hygiene refers to self-care practices for maintaining cleanliness at personal level and preserving health. These practices include bathing every day, washing hands with soap, wearing clean clothes, brushing teeth, grooming and so on. Wash your hands frequently and thoroughly. Wash your hands with soap and water or clean them with an alcohol-based hand rub. Observe isolation if sick. Stay at home if you are sick or have even slight fever, cough and difficulty in breathing. Seek medical attention and call in advance. Do not touch your face. Do not touch eyes, nose or mouth with your hands as they may have touched contaminated surfaces and picked up viruses. Maintain physical distancing. Maintain at least 1 meter or 3 feet distance between yourself and anyone who is coughing or sneezing. The effective practices to maintain respiratory hygiene at workplace are: cough and sneeze etiquette. Cough or sneeze in the elbow. Use tissues to clean after coughing, sneezing. Face masks. Wear appropriate face mask at workplace. Avoid touching face and mask unnecessarily. Dispose it off properly in closed bins after use. We come in contact with people at workplace who could be asymptomatic carriers of infection, which makes us all vulnerable unknowingly. Something as simple as talking, coughing or sneezing is enough to spread the infection from an infected person to others. Social distancing simply means maintaining physical distance of at least 1 meter, or 3 feet, from others. Some key points for maintaining workplace hygiene are: disinfect work area frequently, including desk, things and so on. Avoid unnecessary travel and meeting clients in person, schedule and meet online. Avoid scheduling meetings with peers in person, schedule video conference instead. Wear necessary personal protective equipment, or PPE, such as face masks and shields. Keep alcohol-based sanitizers handy and use them often. Let us watch a video that shows how to wash hands with soap and water. Let us watch a small video on how to clean your hands using a sanitizer. There is a proper way to wear a mask as well. Let us see that. At work, our hands are exposed to all types of surfaces during the day, as everything we do involves hands in one way or the other. This makes them prone to various germs and viruses that can lead to sickness. Some key highlights of maintaining hand hygiene at workplace are: wash hands with liquid soap and water at regular intervals to maintain cleanliness. Follow proper hand washing techniques. Sanitize hands often, especially after using mobile, laptop, or touching any surface. Use alcohol-based hand rub or sanitizer. Avoid touching eyes, nose, ears, or face unnecessarily. Avoid shaking hands. Let us now learn about the types of face masks. Face masks are worn to protect the wearer and the people surrounding him/her from infection that is carried in the droplets sprayed from coughing, sneezing, and talking. Masks worn by non-health caregivers are largely to protect themselves from dust and microbes. Cloth masks. A simple bandana made of cotton may be fashionably apt but offers virtually no protection from disease-bearing droplets. For a cloth mask to be effective, it should be made of tightly woven 100% cotton and sewn in 3 layers. Surgical masks. These are flat, thin paper-like masks which filter out 60% of inhaled particles. It provides barrier protection against large droplets but does not have an airtight seal. They are of single-use type and should be discarded after each use. N95 masks. These are personal protective devices and are made of melt-blown yarn. They are able to filter out 97% of airborne particles. They are tight-fitting masks and have to be worn carefully lest some leakage occurs.